Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. Met an interesting patient or a interesting case I had seen today. So this patient actually is a pregnant woman. She is currently 11 weeks pregnant and she had come with history of right shoulder pain. She has been having a bit of hiccups. So the gynecologist referred her to us. So as a part of the routine investigation, just got her common blood test done and then we got an ultrasound abdomen done. That's when we came to know that she has gallbladder stones and that is what has acted up and that is the reason she has developed this. So to understand this, let me tell you a little bit about what exactly is a gallbladder stone. We medically call it as cholelithiasis. There are different phases of this gallstone. First is the lithogenic phase where it is just getting formed. Second is an asymptomatic phase where it is the gallstone has already developed but it is not causing any symptoms or any manifestations. The third is a symptomatic cholelithiasis, that is it is having symptoms. The fourth is of course a complicated one where there is already complication that has developed. So gallbladder is an organ that is present in the right upper part of your abdomen. So it can present either with upper abdomen pain or right sided upper abdomen pain, or you can have a bit of acidity, nausea, vomiting. So why did my current patient have pain in the right shoulder? That is because there is a muscle layer that exists between the abdomen cavity and the chest cavity. This muscle layer is called as a diaphragm. So this gets innervated, that is the nerve supply for it comes from a nerve called as phrenic nerve. Since the nerve supply is common, that's why the pain that is over here has been radiated to the shoulder blade. So that's why people present with shoulder blade pain. It will cause a bit of irritation of this nerve which results in hiccups because that is again near your throat region. So that is the reason she presented with on and off hiccups. So how are we going to treat these patients? How are we going to investigate someone who has gallbladder stone? Does everyone need surgery? No, not necessary. Let's say you're someone who is in a lithogenic phase that I mentioned or asymptomatic gallstone phase, you might not require surgery usually. When you have a symptomatic gallstone or it's a complicated gallstone, then we definitely have to go for surgical options. So how are we going to identify who wants, when is it required? We do a battery of blood tests. So in that we know about the status of your liver, your complete blood count, are you stable for a surgery, how good is your sugar control, etc. And to check for the gallbladder stone per se, we do imaging like ultrasound abdomen, we go for MRI, we go for CT scan. Let's say that it goes and obstructs the stone that is there, it goes and it obstructs the gallbladder or it goes and it obstructs the common bile, which are the surrounding structures, then we might have to go for a procedure called as MRCP. So depending on your presentation, depending on where exactly is the stone, what is the size of stone, we decide on further investigation and the treatment options that are available for you. So I said not everyone requires surgery. So when it comes to diet, we suggest you to go for low fat diet. We tell you to drink plenty of water. So who are these people who are at risk factor to develop a stone? Stone basically forms when there is an imbalance between the bile that is formed and the water supply that is there in the body. So let's say you're taking too much of cholesterol in your diet or the bile is not getting flushed off. This bile will form a stone or the cholesterol will form a stone. So how are we going to flush it off? By asking you to drink plenty of water. How are we going to reduce the source? By telling you to reduce the fat content in your diet. So this is the way to prevent the formation. And who are those who are at risk? Well, let's say that apart from that you are someone who has reduced weight all of a sudden, there is drastic weight loss, then definitely you are at a risk of developing gallbladder stone because the cholesterol is coming and getting deposited inside your gallbladder. We are not able to flush it off faster. Let's say you're losing about 1 kg a week, then it is not recommended at all. That is the reason we always suggest you to go for slow and steady weight loss programs. Now we have already diagnosed that you have a stone, but you're not symptomatic. And still I advise you to go for a surgery. When will I say that? Only if your stone is more than 2 centimeter in size or it is at a verge of causing an obstruction, or your gallbladder has already calcified. In these cases, or you're someone who has a liver disease, or you're someone who is going to donate your kidney or some organ, or you're going to receive a kidney or any other organ, or let's say that you have a portal hypertension or you have diabetes, you're immunocompromised. In these cases, we do not want to take a risk. In those cases, we suggest you to go for a elective surgery. And what are the medical options that are available? We try to give you bile salt therapy. So we will be putting you on medication with that. Apart from that, if it is a very small stone, we can even go for extracorporeal shock wave therapy. So externally, we give you a shock wave and we try to break the stone. So these are the other options that are available. When do we go for a surgery? When it is a symptomatic stone or it is a complicated stone. So in that case, first of all, we will stabilize you. If there is an infection, if there is an obstruction, we first identify the site and we see how we are going to manage. We will be giving you IV fluid, we will be giving you antibiotic. Let's say that it has become infected, it is causing instability, your sugars are not controlled. So all those things we will try to take care of and then go for the surgery. Surgery, again, we have multiple options. We can go for an open surgery, we will be going for a laparoscopic surgery, or we will be going for a robotic surgery depending on your symptoms, depending on the condition of your stone. So how are we going to handle the complication? There is something called as ERCP, where when there is an obstruction in the common bile duct or something, then we try to treat it. If you have a pancreatitis, then we will be looking at your amylase, lipase. We try to see if the stone is obstructing the pancreatic duct. We try to remove it. Thereby, we will be treating it and we will prevent further episodes. Even after the surgery, we will be putting you on diet restriction. We will suggest you to drink plenty of fluids. We will suggest you to reduce the fat content of the diet, as this can, we have just removed your gallbladder, but the other organs are still present, like your pancreas, like your common bile duct, and also this can get obstructed, which we don't want. So that is the reason we suggest you to go for a low fat diet. Again, post surgery, any surgery for that matter in the abdomen region, we suggest you not to lift heavy weight for the next 6 months after surgery. Other than that, there is no other specific restriction. You can travel as usual, you can work as usual. Just be cautious about your diet, that is low fat diet. Exercise, you can continue, you can go to your gym, provided you are completely recovered after surgery. So it's a very simple procedure, but it is a life-saving procedure. Does a gallbladder stone get converted into cancer? No, we haven't seen any such cases until and unless there was already something that was contributing to a cancerous transformation. Then this stone could have just coexisted with that and could have resulted in a cancer. But per se, gallbladder stones don't cause cancers. I hope this video was informative. I would be meeting you with many more interesting videos.